Hi, my
Hi.
name's Julia Daly. I'm a CNL student. I'm going to be doing your interview today.
Okay.
What brings you into the office?
I'm here for my regular physical.
Do you mind if I write while we talk?
No, of course.
Perfect. And what gender do you identify yourself as?
Female.
Female. And what is your ethnicity?
American, Caucasian, a little Brazilian.
Very good. And how do you perceive your health?
Relatively good. Like there's some things I could probably work on, but overall okay.
And do you do any activities to improve your health? Any special diets?
Trying to have like a low carb diet. Actively trying to lose weight. Going to the gym. I have like home videos I also do for the gym. But that's about it.
Okay, and we went over, you say you exercise. Have you had any changes in your sleep at all?
Nope.
Do you feel, how do you cope with stress?
Try to like play with my daughter a little bit. She's 3, so we try to have a good time. Go out to activities, hang out with some friends. Those kind of things.
Do you have any allergies to food, the environment, or medicines?
No.
Do you have a history of any childhood illnesses?
No. Had the chicken pox, strep throat a lot. But other than that, no.
Do you still have your tonsils?
Yes.
And do you have any lasting effects from any childhood illness?
No.
Any history of surgeries?
No.
Any history of hospitalizations?
No.
Any accidents or trauma?
No.
When was your last physical?
About a year ago.
Okay, and you said you have a daughter, and that was 3 years ago that you had her?
Yeah.
Do you follow up with a gynecologist?
Every couple years, not as probably often they want me to, but.
Okay, and when was your last pap smear? Every couple of years?
I had one last year.
Okay, perfect. Do you use any contraceptives?
I have the Mirena.
Any routine medications that you take regularly?
No, I take a vitamin.
Okay. And could you tell me a bit about your family history on your mother's, did your mother's mother have any health issues?
She had heart failure, high blood pressure. I think she had atrial fibrillation. I think that's it.
Okay. And did your mother's grandfather have any health issues?
I never met her. I met him rather. And she never really met her father either. So I don't think she knows anything about it, and she didn't tell me anything.
Okay, and your father's mother, does he have any health issues? She have any health issues?
Not that I was told. They passed away before I was born, both
Okay.
my father's mother and father.
And do you have siblings?
Yep.
And do they have any health issues?
No.
And going back to your mom, does your mom have any health issues?
She has high blood pressure.
And does your father have any health issues?
No.
Do you have a good support system at home?
Yeah, I've got a lot of family at home. Help me take care of my daughter. And if I need them for anything, they're usually right there.
Okay. And who do you live with?
I live with my mom, my daughter, and 3 siblings.
Do you have any safety concerns at home?
No.
Do you feel like you live in a safe living environment?
Yes.
Do you use seat belts?
Yep.
And when you're outside, do you use sunscreen?
Yes.
Does the home that you live in have carbon monoxide detectors?
Yes, it does.
Okay. And what do you do for work?
I'm a nurse at Lawrence General.
Are you sexually active?
Yes.
Do you have any financial concerns or concerns about getting prescriptions or health care?
No.
Okay. I'm just going to review just some basic health questions. You can answer yes or no, or if you have anything to add, please let me know. How tall are you?
5'8".
And how much do you weigh?
200.
Do you have any weakness or fatigue?
No.
Fever?
No.
Any skin concerns, rashes, or moles?
No.
History of headache or dizziness?
No.
Changes in equilibrium?
No.
Have you ever had a head injury?
No.
Do you wear glasses?
Yep. Glasses and contacts.
And when was your last exam?
Couple last month actually.
Good. Any pain or tenderness in your eyes with the contacts?
No.
Any tearing,
No.
dryness? Any hearing problems?
No.
Are you okay hearing, having the conversation that we do now in my normal voice?
Yes.
Okay. Any colds or nasal stuffiness?
No.
Frequent nosebleeds?
No.
Any throat problems? You said you had strep throat younger. Have you had any recent strep throat?
I had one about a year ago. Actually, over the summer I had one. And I ended up having an ear infection as well. I put on antibiotics and they cleared up.
Okay. Any problems with your teeth or gums?
No.
When was your last dental appointment?
About 6 months ago.
And any problems with your neck, mobility, stiffness?
No.
Any problems? Notice any swollen glands?
No.
Any problems? Do you do regular self-breast exams?
Not as often as I should, like not every month, but I do some time to time.
Okay, when we do your physical exam, we can go over how to do a proper self-breast exam.
Okay.
Any pain or discomfort?
No.
In your breast? Any cough, cold, asthma history?
No.
Difficulty breathing?
No.
Difficulty breathing when you walk or run?
No.
Any heart problems, palpitations?
No.
High blood pressure?
No.
Any problems swallowing?
No.
History of heartburn?
No.
Any changes in your appetite?
No.
Your last bowel movement?
Yesterday.
And was it regular for you?
Yes.
Any history of constipation?
No.
Any problems with leg pain or pain with exertion?
No.
Any problems urinating or urinary tract infections?
No.
Any kidney disease?
No.
You said you go to a gynecologist. Have you had any discharge or problems?
No.
Any joint pain or stiffness?
No.
Gout?
No.
Back pain?
No.
Bruising?
No.
Excessive bleeding?
No.
As far as, have you ever had any problems with depression?
No.
Or nervousness?
No.
Any changes in mood?
No.
Any problems paying attention?
No.
Headache?
No.
Dizziness?
No.
Pins and needles
No.
in area? Any thyroid problems?
No.
Excessive thirst?
No.
Hunger?
No.
Or change in glove size?
No.
Okay. This pretty much concludes our interview. I'm going to just step out so that you can change into a Johnny and we'll continue on with your physical
Okay,
exam. It was
very
very
good.
nice meeting you.
Nice meeting you too.